Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston, and I went to speak today on breast implants and specifically when to exchange them. So this is a breast implant, an extremely well-studied device, and it's not a permanent device, and I think that's a really important thing for patients to know. This is not expected to stay in your body forever. So when are you supposed to exchange it? The FDA recommends at approximately 10 years you exchange it, and the reason for that is that the wear and tear on an implant can create a rupture. And with a silicone gel implant, that would be a silent rupture that you wouldn't know. It's also recommended during that 10 years that you get an MRI to evaluate the implant at about 5 years, and then every 2 to 3 years after that. So why would you get an implant replaced before, say, that 10-year point? Well, if there's a problem, if unfortunately you were in a car accident or some type of pressure created damage to your implant, you would want them exchanged. Something like capsular contracture, which is the tissue that forms around the implant getting hard, that could create a non-aesthetic or even painful outcome, that would be reason to exchange. Unfortunately, implants can move in some cases, and then that would be also a reason to exchange them. Also, an aesthetic change in your life. So at one point, larger breasts and larger implants were nice for you, and then perhaps down the road, they aren't nice for you. You want to exchange them. That would be a reason too. So for my patients that have implants, I like them to follow up with me every year or every 2 years during the 10-year period, just to stay in touch, making sure things are safe, making sure that we know what options are available, and when to deal with problems really before they happen. Thanks for listening.